Welcome back to the Horse Racing Show. I'm Kenny Rice. Delighted to have with us a good friend of mine and well known throughout the world, Dr. Larry Bramlage with Rood and Riddle. Doctor, good to see you.
Good to see you, Kenny.
And I got to tell you, it's good to be able to interview you like this because for people that have watched over the years on NBC, we always had those very tedious, tense moments, not personally, but because of what was happening. I would come to Dr. Bramlage to ask about a horse injury for those that watched, and he was a spokesman for years for the equine practitioners. And so we had some, you always handled it so well and got right to the facts. And I know a lot was going on and a lot of information was coming in, and you dissected it and dispensed it so perfectly.
Well, thank you. It was nice of you to say. It was a good program. It is a good program. For nobody likes to see a horse injured. I mean, people love horses. Even people that don't know why, maybe have never touched a horse, they love horses. So it hurts people when a horse gets hurt. And, our job was to take the information and give to the people in a way they could process it. So even though they weren't happy about it, at least they could put it to bed in their mind to know what happened and that the horse was going to be taken care of.
Especially on big shows. Derby, Preakness, Belmont, Breeders' Cup, where you have an audience that doesn't always watch horse racing. They may be watching it 4 times a year, and the Derby, it might be the only time they watch. You could say anything, and they're going to go, huh? A cannon bone injury. What? But you always put it, I think, more in layman's terms that at home you could go, okay, I get that. I can relate to that. So that's like having whatever part of my body's injured.
Yeah, people sort of understand their own injuries and have a perspective that way. So if you can put the perspective in a frame that they can identify with, well, then they understand the horse's injury a little better.
Okay, what's going on right now at the hospital? What's happening in the veterinarian world?
Well, we're just gearing up to looking at yearlings right now. This is the season early in the year when the consigners look at all their yearlings and check their joints to see if there's anything they can take care of, because they'll go to the sale in September, and when they go to the sale, there's a catalog of x-rays that's available for the purchasers to look at, and whenever they want to buy, that helps them assign the value to the horse. So horses, they grow 20 times faster than we do. They're mature in 2 years, not 20, and they get 10 times the size. So their bones are growing amazingly fast, and so there's these accidents of growth called OCDs. It's a Latin term for a little fragment in the horse's joint, and they have quite a few of those. And if they have developed one of those, they do it before 10 months of age. So we're looking at them all now that are 10 months of age, and if there's something we can solve, then they go to the sale with clean radiographs, because it's not so much that each particular condition bothers the horse all that much. What really bothers their value is trainers don't like to buy horses that they got to then do surgery on, not so much because they're afraid of surgery, because surgery is fairly routine now, but it puts them off schedule with breaking the horse. They're getting 20 horses coming in. They can't have an individual schedule for all 20 horses, so those horses bring more money at the sale if their radiographs are clean, and that's what we're about now. We're doing arthroscopic surgery, taking out the fragments that are just mostly nuisances, but would lead to arthritis when the horse is training heavily.
And as far as then the race horses, we're already on that Derby trail, had some races over the weekend. What a stunner, by the way, Bob Baffert won a big race in California.
Yeah, I
hope it's a breakthrough for that young trainer.
5 of the 6 grade ones this year. Bob Baffert can train horses. There's no doubt about that.
And when do the trainers? What's the relationship you have with trainers when they bring them to Rood and Riddle, or you go out into the field, or how does that work with the horses that are on the track now that are racing now?
Well, I have sort of gradually gotten to the point where I stay in the hospital all the time now, and we get a regular flow of horses coming from the racetracks, mostly horses that are off form and don't have any obvious problems. I mean, if they've got a chip in the ankle or chip in the knee, those guys at the racetrack, the veterinarians and the trainers, they're going to find that. That's not a problem. But about this time of year, when you get towards the end of the meets in Florida and New Orleans and Hot Springs, if a horse is not performing, they will send them home to see what's wrong with them and hope that we can solve their problem and they can pick them back up when they come into town in April and May. So starting about the middle of March, or maybe the first week in March, those horses are arriving from all the different places when it's obvious they're not going to perform there during that meet.
So you got the future race horses people are hoping in the yearlings. You got the current raced horses, and they'll all converge at one point in time, and it'll be a crazy month or so for you, a couple of months.
And then about 6 weeks or 2 months after that, the foals start showing up. And, foals are showing up now for mostly medical problems, but from my perspective, where I work is where what we'll be doing is looking at foals that have conformation faults. Horses are, we talk all the time about how economical a horse's skeleton is. A thoroughbred racehorse is so fast because he doesn't carry any more weight than he absolutely has to in order to get himself around the track. So when you're on that light a frame, if it's perfectly balanced, you're less likely to injure it. And that's why with foals, we're working on those foals to assure that they have the best conformation that they can have.
I have friends that follow mostly other sports, but they'll tune in and watch a horse racing show that I'm on. And inevitably they're going to say, you know what amazes me? Those little legs carrying 11 or 1,200 pounds around. How do they not have an injury all the time?
Well, it is pretty amazing. I mean, they're not born with racehorse skeletons. They actually make them while they're training. And all horses, all light horses, show horses, performance horses, race horses, they're born with a sort of generic skeleton. They look like thoroughbreds, but their bones are an average size. But then when you start training a horse, and the bones respond, and though their cannon bones look fairly small when you compare them to the whole horse, they've tripled in size since that horse starts training. And that's how responsive the bone is. So the horse adds bone where he absolutely has to have it, but they don't carry a draft horse skeleton around the racetrack because it would be dead weight.
Right.
And so they're like Ferraris. They're just as economical as they can be with their structure.
That's why we have you on. I guarantee there's guys that sat at the rail for years trying to wheel those bets that did not know this.
Well, it's the racehorse, the thoroughbred racehorse is an amazing animal. And I've said before, I wish at some time in my life I would ever have been as fit as those horses are. They're just so fit that the saying is they're jumping out of their skin. But if you watch a racehorse, you know exactly what that means because they have so much energy. They just want to do something, and sometimes their decisions aren't right. They can hurt themselves too.
Yeah, I think it was a Wayne Lucas line. I'll give him credit right now. Somebody might have said it before them, but I remember he said, horses, you got to remember they get up every day figuring out a way to hurt themselves.
Yeah, that is almost the case. They just have so much energy. They're like a 4-year-old child who doesn't know what to do with himself, but he has to wear out so much energy during the day in order to get to sleep at night. So they are amazing animals.
This is a cold and flu season for many of us. Do horses get colds?
Absolutely. The yearlings now are passing viruses around just like the kids pass viruses around in school. But the big ones are similar diseases to people, not the same disease, but the same category, influenza, the herpes virus respiratory disease, and then there are several other kinds of herpes virus as well. But horses get those things. Fortunately, the vaccination programs that the trainers use and that most people use on the farm, there used to be huge epidemics of influenza. In fact, it was a reportable disease for a while. The government you had to report it to the government, but now the vaccination programs are good enough that they're pretty much controlled.
Doctor, fascinating as always. Please come back.
I will. This is fun.
I'm going to call Rood Riddle, say, send Larry back. Then all the other vets will get mad.
That'll be my pleasure. I mean, they won't get mad.
No, we go back a long way.
Yeah, it's good to see you.
Good to see you. Thank you so much, Doctor.
You're welcome.
Stay with us. We'll wrap things up here on the Horse Racing Show. Be sure to follow us on YouTube, at iTunes, at Google Play. Go to our Facebook page and like us, and then also go to @horseracing, and you can go to thehorseracingshow.com. Look at this, Larry. We're just like social media mavens out here, aren't we? Just throwing all this stuff out.